Good afternoon, everyone. I am Dr. Vinayak Mehta, and the topic of my presentation is progression of diabetic retinopathy in patients using gliptins versus patients using other hypoglycemic agents. Being in India, we all are familiar with the burden of diabetes and diabetic retinopathy. Current treatment guidelines focuses on fairly advanced stages of diabetic retinopathy, and no treatment options can prevent or delay the onset or progression of diabetic retinopathy. Uh, Recent studies using SDOCT have shown that neurodegeneration in retina starts much sooner than the clinically visible vascular signs. DPP4 inhibitors are a new class of anti-hypoglycemic agents which can be used and are also known to have neuroprotective benefits because they can reduce the apoptosis of pericytes and Muller cells, and they also have a reduction in oxidative and inflammatory stress on retina. So they kind of provide dual benefit to the patients and can be hypothesized to have delay the onset of progression of diabetic retinopathy. So we did a prospective study where 60 patients were in group using gliptins, and there were 60 patients using other hypoglycemic agents. Patients who had type 1 diabetes, hazy media, uncontrolled hypertension, poor glycemic control, or they had a history of previous treatment for diabetic retinopathy were excluded from this study. All patients underwent a comprehensive ophthalmology examination using slit lamp, fundoscopy, grading of diabetic retinopathy, fundus camera, and OCT. All patients were followed up after 1 year. So the results that we obtained is that most of our patients, 70% of the patients had duration of diabetes for less than 15 years. The graph over there shows that number of insulin users in the non-gliptin group were significantly more, and the patients who were in the gliptin group, for 53% of the patients had taken it for more than 2 years, and 47% used gliptins for less than 2 years. The table 1 over there shows that there's a fairly comparable values of HbA1c in both the groups over the period of study, which tells us that there was a good glycemic control maintained throughout the study period. Table 2 and table 3 shows us that shows the number of eyes, not the number of patients. It shows the number of eyes with diabetic retinopathy status at first visit and second visit in both the groups. What we observed that 8 out of 120 eyes in the gliptin group had progression of diabetic retinopathy, and 11 eyes in non-gliptin group had progression. The p-value was 0.473 and it was statistically non-significant. Coming to the discussion part, the studies that I've mentioned, it shows that most of the studies are in favor that gliptins have a neuroprotective benefit, but most of them could not prove that it was statistically significant. One of the studies which was done by Green JB showed that patients had a contradictory results to the current belief, and patients in sitagliptin group had more progression than the placebo group. As observed that in our studies, even though the gliptin groups had lesser progression of diabetic retinopathy, but it was not statistically important. The strength of our studies lies in having a good glycemic control and fairly comparable group and using ETDRS classification, and limitations being smaller sample size and shorter duration of follow-up. I conclude my study by saying that DPP4 inhibitors did not have any added advantage over the other hypoglycemic agents, nor did it have any deleterious effects. And we can recommend having a prospect of a large study with a larger sample size and longer duration of follow-up. Thank you.
Any comments? Tell me one thing which we gained out of this presentation.
Sir, there are so many hypoglycemic agents that we have been using, but gliptins are a new class of drugs, and still we are comparing the efficacy compared to the other ones. There is no drug or treatment option that currently we are using for diabetic retinopathy which can halt it at the beginning of the onset. Whatever treatment options we have is once the patient has already crossed moderate NPDR or is in severe NPDR. So we cannot prevent the onset. But if we're treating a patient with diabetes and we start them treating with them gliptins, not only we are providing a good glycemic control for the patients, but we are also trying to reduce the onset. so that if we reduce the duration of the onset of diabetic retinopathy, along with good glycemic control, we are providing fairly good amount of years for a patient to have a to maintain good vision.
See, my point is, some or the other drug will have to be given to control diabetes.
Yes, sir.
No drug claims that it will halt the progression of diabetic retinopathy. Same came out with these gliptins.
Yes, sir.
So what new we found out?
Sir, it has only added to the current knowledge of our like status about the gliptins, but being a smaller study and a shorter follow-up, we cannot tell anything based on the evidence, but we can definitely have a prospect of a bigger study.
Okay, thank you for your